tremendously. It gives you a real quick framework. And when you're talking about, doing physicals, or you're seeing a lot of athletes real fast, maybe you work in an athletic training room, maybe you work high volume, man, a selective functional movement assessment is fast. You can get it boom, 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 boom. Hi, everyone. Welcome back to the podcast. Hi, everyone. Welcome, new listeners. Welcome to the podcast. For those of you who have heard my content in the past, welcome back. Today, I am fired up. This is a topic that is a direct question from somebody who sent me a message on Instagram, and they were asking me about what other things should I set myself up for success with to be able to become a sports specialist or a sports expert? What courses or certifications would you get? And this is actually, I've had this numerous conversations with people, and I wanted to share with everybody on the podcast so that everybody kind of gets to hear my same input currently with where I'm at right now. Before I get into the podcast, I wanted to just give an update. What is happening in my life? Things are actually really, really great. If you were to ask me every couple months, I go in through different stages. At this at this stage of my life, being a father, a mentor, leader, coach, just all the above, I'm really into the humanitarian aspect of like what I do for people, what I do for my kids, what I do for my team, what I'm doing for myself. So I'm on this like big kick for just riding that wave of making just living my best life, but also making giving opportunities to those who are in my circle, who are in my world, an opportunity for them to really become the best versions of themselves as well. So, for those of you who are newer to my podcast, that's a little much for you. But for those who've been listening to me, you understand my progressions, and you'll see it over the podcast over the next few months to years that anybody who hears my content, all I ask is that you grow with me. Some of the stuff might be not ready for you wherever you're at. So I know I have a lot of PT students at the moment who are listening. I have got some new grads and I have veteran PTs. And as I grow, I just expect that everybody grows with me, both personally and professionally. That's a big deal to me. And you come to my seminars, you come to my workshops. That's the thing I'm going to ask for you. I'll teach you the skill set. I'll teach you the mobilization or the taping or the things you can learn anywhere else. But ultimately, I'm trying to help you guys understand what it is that you guys do for people. And ultimately, I think that you have to take a big step in your personal growth in order for you to get better professionally. So that's where I'm at right now. All right, on to the podcast. So this is a good question posed. If you're looking to become a sports specialist, a sports expert, whatever you want to call yourself, either way, you want to be the best version of yourself. You want to be the best possible clinician. I don't know what that means to you, right? Like everybody's going to have a different perspective. But what I do know is that you're obsessed with acquiring the skill set to become viewed as the best in your either community or your job, or you want to set yourself up for a good position to be able to take on a big role somewhere or do some things. And there's different certifications that you can get. And gosh, I can't even keep up nowadays with so many that are online or virtual or in person. And, there's people all over the place that doing it. And I'm going to give you a framework. And if you know my content, I don't like to give answers. I'll give more questions and I'll give frameworks, and you just insert whatever you want. So I'm going to give you a couple different ones. But ultimately, before we talk about exact certifications, I want to explain my framework in what I view as like the perfect sports specialist, sports expert, whatever you want to call it. And I think there's a continuum, and you want to see it as a circle. If you want to see a continuum, it doesn't matter. In a continuum, you have a human or an athlete or a patient or a client, whatever you call them, and they're going to need help throughout their whole life. Right now, there might be a pro athlete or a high school student or a college athlete or a professional soccer player, whatever it is. And in my view, I am all about helping people throughout their lifespan. I've worked in the pro sports. I've worked in several capacities. I've worked one-on-one, traveled with a professional athlete around the world, and I truly understood that what we do for people is great short term, but ultimately you're trying to help them develop their own skill set so that they can be independent. They know how to take care of themselves. They know their own progressions. They're always going to need your feedback. But just like you guys, you're always trying to get your patients and athletes and clients like independent. Like you need to know what you need to do, and I'm not going to be around all the time. And that's what you're trying to do. And that's how I work with the people I mentor. It's the same concepts. I'll give you the framework, but I can't insert every single answer. So for the certification question, which ones would I recommend? I think you have to understand the spectrum, how you're going to help somebody across a lifespan. Whether it's an athlete, if we talk about in-season, off-season, preseason, there's different spectrums of how to manage people. So I think that if you look at athletes, you're going to manage acute injuries from hour zero to day 3, day 5, day 6, whatever it is. So you have the acute management, you've got subacute management, you've got most people, and this is my bias, but I think that PTs in a normal orthopedic setting, I think that we're like 4 to 6 week specialists. I think that we won't see them just because of insurance and all these other things. You won't see them typically till about 4 weeks, maybe if you're lucky 2 to 3. So most people don't get the acute or subacute. And then you'll typically get maybe into the chronic world, or definitely subacute to chronic. That's kind of where we linger. And I think most of us want to get into the acute or subacute. You just need exposure. So I think a lot of PT courses really help you hone in on your strength, which is your subacute, maybe even chronic. I'd say we're chronic specialists or somewhere in that realm. And then, if we're talking about post-op, that's different. Post-op, you could definitely see them subacute, day 7, 8, 10, whatever it is. So from a post-op perspective, that's probably your closest you're going to get from an acute injury all the way through on a common basis. So you'll see them from, post-op week 2 all the way up to probably month 3, month 4, depending on their insurance and verification or their motivation, their intent, whatever it is. But ultimately, your goal, your vision is to be able to get maybe like a post-op from day 3 all the way out to at least a year, maybe a year and a half. And you might say, Chris, why would you do a year and a half? Like, can't you just get them better before then? The reality is, do you really think that they're never going to have pain again? Do you really think that just because you rehabbed them a year out, that they're not going to need your help with progressions to accelerate, decelerate, plyos, return to full throttle soccer, whatever it is? And if you know that framework, understand my expectations that you're going to have acute management, subacute, chronic, return to sport, return to plyos, return to run, maybe even get into endurance and strength and conditioning. And then you have to talk about return to sport. And then you have like technical skill or like coaching. That's a different world. And I think that if you understand that spectrum, you have to ask, okay, so now if I know the framework, I have acute, subacute, chronic, plyos, strength and conditioning, endurance, and return to sport. All right. So if you know that, the question becomes, which courses will help within that whole spectrum? Now that's a different question. That somebody asked, what courses should I take to become, a sports expert or prepare myself for the sports world? Man, that's a loaded question because there's a variety of cases that you're going to do, but you can break it down easily along that spectrum. So as a clinician, especially as a new grad or a PT student, you're like, oh my gosh, it's overwhelming. Do I focus in on developing and honing my strengths, or do I work on my weaknesses, or do I work on platforms that I want to be in but I don't have exposure to? And that's a personal question you kind of have to ask yourself, but ultimately I think you could do it all. And the easy way to see this is, well, can't you just do a residency and get a glimpse into all of that? Absolutely. And I've been through that, so I understand what that feels like. Now, that's not an opportunity for everyone, and I completely understand that. I mean, there's a lot of questions whether, why you should go to a residency, or should you or not. It's not for everybody, and I'll do a different podcast on that. That's not my point today. My point today is along that whole spectrum, a residency would cover a lot of that, but that's really only going to be probably about a year and a half, 2 years max. And in reality, you're going to need a lot of mentorship, a lot of guidance within all those spectrums. Just because you go for a year doesn't make you an expert. It just makes you well equipped to have little pieces of all of it, and then you just hone in on bits and pieces of that. Now, when I was working pro sports, I did the residency. I was able to work in at the Olympic Training Center in Chula Vista, and I got to see a little bit of all of that. And then I honed those skills for 3 years. Then went to NFL Combine training and got to see the actual performance side of that. Did that for about 2 years, and then traveled one-on-one with somebody for an extended period of time, and that allowed me to put it all together. Now, that that wasn't planned. That was definitely like opportunities just put me in the right position. Now, if you're saying which ones should I take, what do you want to hone in on? I mean, do you want to do acute care? Excuse me, acute injury management? Do you want to do subacute? Or you just want to hone in on the strengths where you're going to be in orthopedic setting? That's a different story. So I'm going to provide a couple different options. And then that way, I'm going to put it in that framework and you have to answer that yourself. So, all right, if you're going to go into acute injury management, there's not a lot of courses that I know of that are, in the typical PT realm. And I'll have some good insight to this at the end of this podcast throughout, because what I'm trying to do is fill the gaps. I'm trying to fill the gaps on, if we're going to try and build a sports PT in my PT Academy, what would that look like? And the closest things I can think of are residencies, but what about, that people who ultimately are, not doing residencies, but in orthopedics, but they are looking for additional opportunities, and that's what I want to be able to bring in. And when you are doing acute injury management, it's very case dependent. Most orthopedic settings will see maybe an ankle sprain, an acute back, a shoulder flare up, a knee injury, traumatic, whatever it is, but it's so rare. So I'm looking to bring on some acute injury management courses. Now, from a management technique, most of the time I would say at least a basic taping course. So this might look like and I have no affiliation with any of these courses, so I'm really just giving my feedback, and I have no financial interest in any of these things. But maybe like a rock tape course or a kinesio tape course and some type of elastic taping course, or I don't even know if there are courses like rigid taping, white taping, McConnell taping, Leuco taping, but those type of cases, when used properly, they're fantastic. They fit so well in the whole spectrum, and they're just more tools in your toolbox. And I understand it's a little cliche, but you will need them, and sometimes you just need a couple just to be prepared and use those concepts to apply it to the neck, to the shoulder, to the elbow, to the knee, whatever it is that you want. So ultimately, acute care management, I think you need to at least have a basic taping course. From a subacute standpoint, it's going to be the same. There are mobilization or grade 5 manipulation courses. I think that when used properly, I think if you don't see them very often, I think it's very risky. If you use all the criteria and classification techniques to be able to do that and make a very sound decision, that's completely up to you. I think that's great. So I think mobilization or manipulation courses are great, along with taping courses early on. I think that's no problem with that. And I'm telling you these because you can ultimately find the ones that are near you or whatever it is. I don't have a name brand. I don't have a specific course that I absolutely love. I want you to give the concepts and start looking into which courses match that for you, and then where your gaps are within the whole spectrum. And then in terms of when you talk about, pain management, I definitely have a bias. I think that with pain management, there's going to be so many techniques you can do. Any variation that you want, McKenzie and all these other things. But if you're talking about like what's my personal preferences, what I love to do, I'm biased. I've taken a lot of mobilization with movements, Mulligan technique. And again, I'm not advertising for anybody. It's just the outcomes that you can get with athletes. Most of the time they're looking for a quick fix, and I understand that sometimes a quick fix is great for the short term, and then you back it up with everything else, correctives and everything else, education, modifications. But I think that sometimes that buy-in comes in just right when you can get them pain-free very quickly. and mobilization with movements are great. I've done most of the courses now, and I've done one-on-one with Mulligan himself, and I've learned a lot. And at different time points, I use that. So for pain management, if you're asking me for clinical pearls, it'd be mobilization with movements. I've done manipulation courses, grade 5, of the neck, elbow, knee, ankle, all of the above, you name it. I think those are great when utilized in the right fashion. And I'm a big fan of myofascial decompression, cupping. I was first introduced into it in 2011, right before the whole 2012 kind of like Michael Phelps thing, and I've been doing it for a while. And I think that I'm not here to push you on the science side or anything like that. I'm really speaking from a practical standpoint. I think a lot of people go a little too deep on that side, and I'm more of the art and the science, but I love the art aspect of it. And if you're looking for outcomes and you want people to feel better, and then you can use evidence to support that, I think you have to be able to blend the two. So that's my personal stance on that. So I think cupping, or excuse me, myofascial decompression, is a good option. There's several courses. I'll let you choose whoever you want. And then instrument-assisted soft tissue mobilization, I don't care. I don't care what style you use. I think the concepts are great. And I think that if you ask me, what's your current style of practice? I'd say I'm very neuro. I'm a manual therapist with a movement background. And before I was the opposite. And as I go through my professional career, I see what people need and want, and I go based on that. So my current flavor is very much nervous system, proprioceptive, with a lot of modifications and programming. That's a big thing on my personal side. So from a pain management standpoint, Mulligan techniques, high velocity, low amplitude mobilizations, myofascial decompression, instrument assisted soft tissue mobilization. Gosh, that's always a mouthful. All right, and then all right. So on the acute management, I said you definitely need like a taping course. On the pain management side, depending on your flavor, whatever you want to do. And then from a movement standpoint, I think you're able to manage all these things, but I think you have to have a really good lens for movement. And I think that that's kind of been the trend recently over the last decade, more towards movement and awareness of that. So I think that I come from a movement impairment, movement system impairment philosophy. And I think if you ask me, I started out with Shirley Sarman, and she was my mentor early on, and my school kind of gave me that framework. And for those of you who haven't taken the courses, it's very technical. It's very elaborate for some people. It's very spatial awareness, very origin insertion, what moves but when you're prone and sideline, what happens to forces and vectors. And I think it's really, really good as a framework. If you're new to it, you got to take at least 2 courses to really give it a chance, and really, as long as it makes sense to you within your personal framework, I think that's great. And then when we talk about movement as well, I think that early in my career, I started with the movement science, movement systems, and I think from there I started taking more FMS, or functional movement screen courses. I also did the selective functional movement assessment. I think that if you're trying to get nitty gritty, down and dirty, in 2 minutes, tell me what my problem is, I think selective functional movement assessment is a beautiful course. Takes you 2 minutes to figure out globally what's wrong, and then you can dive in with Shirley Sarman's movement system impairments. I think that helps tremendously. It gives you a real quick framework. And when you're talking about doing physicals, or you're seeing a lot of athletes real fast, maybe you work in an athletic training room, maybe you work high volume, man, a selective functional movement assessment is fast. You can get it boom, 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 quickly, and then you can dive deep on who are their problem childs, and then you can go with Shirley Sarman's framework. I also like the FMS, or functional movement screen, because it's a real good glimpse into the injury risk or injury awareness. I think that the word risk is a little challenging for a lot of people. They're like, you can't determine risk. I don't care. I'm just trying to figure out how I can help this person, and who do I need to be more aware of. So if you want to call it injury awareness, great. Functional movement system is beautiful for that. Again, I have no ties to these. I've just done so many of the courses over the last couple years. Strength and conditioning. I think that you definitely need to do the CSCS. I did another podcast on this. Does it really teach you everything you need to know? No, but it gives you a framework, and it gives you awareness into what you can and can't be looking at. Unless you're programming, I think that you need to work with strength coaches and work in that industry to really get really good at it. I think for what we need in clients and athletes, and even if you're working with pros, you're probably working with strength coaches to help you with that. I don't think you need to be fully dived into all of that unless that's your domain. Great, good for you. But I think you just need to be good at every single one of those spectrums so you can help somebody across the lifespan. So even if you're like, well, I really got this ACL, really got, they went back to sport, great. But like, what programming do we need to do to get like true muscle girth up to exactly where we need? What are you working on a strength coach with? You just have to have an awareness. And then if they get hurt with an ankle sprain, you got to be able to manage the acute injury. They almost like slide. They go through this sliding scale of injury and health back to like, whoop, acute injury management. I just sprained my back. I fell on my back and it hurts. Great, manage that, get them all to sport, and they just like come right back. It's like a typewriter if you ever know what those are. Yeah, so they just keep coming back and forth. And so I think knowing what the wheel looks like, you just got to acquire the skills within that wheel based on what you see or you're projected to see. For strength and conditioning, as I mentioned, I think the CSCS is a great framework. If you haven't taken anything from formerly Athletes Performance or Exos, I think that's a great framework for building speed, building linear, lateral, multi-directional frameworks within getting people back to sport. So I think that has its place. I don't know what courses they have anymore, but I used to take and lead some of them in the past. I've done the upper quarter, lower quarter. I'm not sure what their framework is anymore, but they've got a great online capacity and online framework, and then also in person. I'm not sure what's happening there, but I think those two would give you a good framework. Now, if you understand that whole spectrum, we just talked about acute injury management. You got to know your taping. You got to know how to manage acute injuries, and then subacute and chronic. And the chronic side, gosh, that's where we thrive. I think that's where most PT courses are. You can pick whatever you want, but I think that the ones I really love are the mulligans, the cupping, and the instrument-assisted soft tissue mobilization. And then on the strength side, I think the CSCS, anything Exos, I think would be great to help set you up for success. Now, the trouble is, and this is where my passion comes in, is putting that all together. What does that mean? Like, how do I use all these tools? And I have a hammer, I have nails. Like, how do I put this together? Exactly when, into what different surfaces, how often, what pressure, and that's where I'm looking to be able to help people, because I've done the residency, so I've done a little bit of all of it. I still manage acute injuries. I love the acute injury management. It's like my jam. If you ask me what's one of your favorite things to do, is return to sport on paper, like just be able to match that to what expected timeline should be. So I really liked being under pressure. I like short term. I think one of my greatest cases is trying to get a non-op ACL tear 6 weeks from the Olympics into being able to compete, and they did. And man, we just patched everything that we could together, duct tape, you name it. We just trying to put it together. And I love being able to help people do the unthinkable. I know it sounds like a cliche, but man, I love it. It's possible, and you can help some people do some incredible things. The challenge becomes is getting them into your circle, and then secondly, being able to do that and perform and under a crunch time, and that's a big deal. And it's not easy if you haven't had that opportunity. And that's where I thrive. Like that, I love it. I really do. So that's where I'm trying to grow into and be able to help support you guys through that process, because it's really, honestly, it's my passion. I love doing it. I want to share that with everybody. So what I'm trying to do is fill in those gaps and then create a framework to be able to do that. So for most people, even whether you've done residency or not, this is going to be a great opportunity for you to help hone in and put that full circle together. For those of you who haven't done residency, maybe you wanted to or just wasn't for you, I'm looking to help fill those gaps with acute injury management, subacute, hone in on your pain management, give you a better framework for your strength and conditioning, put that all together, and that's where I'm going to be doing it. So how does this tie into this podcast and what's coming up? So I haven't fully launched this yet, but we're going to do, I'm opening 2022 with a course. I'm going to start it with a 1 or 2 day course on being able to set you up for success. So I'm going to be doing 2, 3, maybe even 4 courses in 2022 for putting all these aspects together, and they're going to be a series, so a continuum to be able to set you up. So the first level 1 course will be in March of 2022. If you're interested in learning more, follow me on Instagram, Chris Garcia DPT, or jump into my mailing list, drchrisgarcia.com/mailing-list, and jump in there. Or email me, drchris at drchrisgarcia.com. Either way, I'm going to be hosting this, and if you're interested, I'm gonna keep them small. I'm keeping them small at the moment, but we'll see where everybody takes me. I honestly don't know. I'm going with whatever the feedback is from all of the listeners and those who attend. What is it that you love? What do you want to learn more of? Acute injury management? Do you want more subacute stuff? Do you want progressions? Do you want return to sports? Do you want templates? What is it that you want? Strength conditioning? What would you do? Plyos? What's your progression for linear running? I mean, either way. So these are all where my head is, where I'm going towards for the upcoming year, and I'm excited to share that with you guys. So that is my framework for what courses you should take based on what your strengths are within that whole spectrum. What can you manage? What can you manage? From there, determine which one you want. You add your own flavor. You just need to know where the gaps are and what your strengths and weaknesses are. And then, do you want to work on your strengths? What is the scenario? What's the setting that you're in right now? And then, do you want to continue thriving in that, or do you want to grow into something else? And if you want acute care, you got to be able to manage that, and you can't mess those up. You can't mess up an acute injury. You got to be able to earn more of those. You have to do well, and they're very, very time based, and it's very, very risky doing too much. And that's what I tell new grads, PT students, and even veteran. Don't mess up those acute injuries. You actually flare them up if you treat them like a chronic one, and they won't come back, and that's why you don't get them very often on your schedule. So that's where I'm at right now. Feel free to email me, let me know what you're thinking, but put it on your schedule. March of 2022. I'm thinking first, second, or third weekend of March, and then that'll be at our new location in San Diego. Right near the airport, so it'll be convenient. And then I'll probably bring in maybe 12 to 15, maybe even 20 people, just to give you guys a glimpse into the framework that I use and everything that you might be able to use for all of your athletes, depending on where they are along that spectrum. So there you have it. That was a very big mouthful of certifications, but ultimately I can't give you guys answers directly on specific ones, but I'll give you the framework, and then you insert whatever you need and whatever your strength is. So I hope you guys enjoyed it, and I hope to see you guys in March of 2022. Take care, guys. See you guys.